Hi, my name is Alex Sheen, and I made a public service announcement last week that reached millions of people. The message was about a particular limitation in our healthcare system.
Did you know that healthcare workers can just quit? They can just quit. If the job gets too overwhelming, they can quit and go home.
With so many hospitals currently overwhelmed, I suggested that we shouldn't go to Thanksgiving if it was at somebody else's house.
I am not going to Thanksgiving.
The video received thousands of comments, and some of those comments were from healthcare workers themselves. And together, right now,
I'm a clinical molecular scientist.
ICU doctor.
Respiratory therapist here.
together we would like to read some of those comments to you.
I'll go ahead and read my comment.
And the burnout, it's real. My current hospital has over 100 positive patients. We have 4 ICUs dedicated to COVID, with only 1 ICU left for traumas and burns and surgeries. And it was completely full. Completely full.
We are all doing our part, and we ask America to do their part too.
I run about 1,000 COVID tests per day and have been in for 10 months now. I will not quit. I will see this pandemic through. Afterward, I may leave healthcare altogether, but for now, I'll continue to serve my community.
There was also a comment by somebody who cleans ambulances, and that person said, I was hoping this would be done before I decontaminated 300 ambulances. Now I know I'll be going into the new year with 400. And now I'm sure by the time I get to a year, almost 500. When this is all over, I want to learn, improve. I want to get into podcasting. I want to make music. I want to cheer up everybody like the people I've been listening to cheer me up when I'm decontaminating. But at the moment, I'm waiting to clean COVID ambulance number 359. Now, there were a lot of comments that were very positive, that showed those signs of resiliency.
As an ICU doctor, let me just say, hell yes.
But some of those comments sang a very different song. One healthcare worker wrote, the last month I've left almost every shift asking myself, why did I get into this position? Telling myself I can't take one more night of it. I'm frustrated, I'm exhausted, so I dropped my hours and took a job at an outpatient clinic. You think your mental health is suffering? Think about ours. And a different person, a now former student, posted, I'm ashamed to say that I quit in my last year of nursing study. I just got overwhelmed with the pressure and sadness. I know part of it is just bad luck, but when I was performing CPR on my COVID patient and had to spend the first gut-wrenching minutes alone, I realized that I was doing this for $8 an hour. And a nurse already in her career wrote, this is probably not the message you wanted me to take from this, but as a healthcare worker, this is a good reminder that if I wanted to, I could just quit. I could drop it all, walk away, not look back. I'm lying in bed sick with COVID after weeks of saying that I felt I was working in unsafe conditions, and probably half of the nurses on my floor have gotten COVID in the last month. We are dangerously short-staffed. I have been ground down for months on end, and it has without question taken a toll on my mental health. I'm very fortunate to have a well-paying job that I love and I'm passionate about, but if I just dropped it all, walked away, threw away the years in school and the toil in the last year, and started delivering pizzas again, I would probably be a happier person. So like I said in the PSA,
Stack those supplies to the ceiling, and you still have to have someone actually administer that care.
there was something though in the message that I don't think came across very well. That to me, in many ways, this isn't about COVID-19. In many ways, the problems that we're facing right now, this is about car accidents, this is about brain aneurysms, heart attacks, strokes, and seizures. This is about every single person who would need emergency care for any reason. When hospitals breach their capacity, they have and will tell a patient to go to another hospital. But what if that next hospital you go to is also overwhelmed or short-staffed? How well do you think a hospital is going to take care of you when people who work at that hospital are making comments like I just read to you now? The system is not designed for this volume. in some weird way, a healthcare system or a hospital, it's like a bridge. You can run over a bridge with cars all day long for decades, and that's fine. It's literally designed to do that. Over 112,000 cars drive over the Golden Gate Bridge every single day. But what you can't do is put all of those cars on the bridge at the same time. The bridge, of course, was never designed for that scenario. It cannot carry that much weight. Every bridge has its limits, and if those limits are pushed, it will collapse. Our healthcare system has limitations too. It is not a perfect analogy, but I hope you get what I'm saying. That is why the CDC made an official statement about Thanksgiving, that the safest way to celebrate Thanksgiving is to celebrate at home with the people you live with. Well, that means a lot of us in the next couple days even would have to cancel our existing Thanksgiving plans. They're asking us to make a call, send an uncomfortable text, essentially make somebody in our life that we love upset. You know, maybe that sounds something like this. Mama, you already know this, but I'm not coming to Thanksgiving this year. I know that I get pretty obsessed and involved in my work, and I'm sorry that I haven't been around very much. But you know, Dad died of a lung disease. So I keep thinking about what's happening right now, and I just don't want people to be in the same club that I'm in, you know? So we're gonna have to skip this year. But growing up, you told me playfully, Alex, whoever told you life is fair, they lied to you. Sometimes we have to make sacrifices to do what is right. So that's what's gonna happen. I love you, Mom.